we can discuss the results considering that there were a lot of heterogeneity of measure for duration of effect. And at the end, there was no clear guideline emerged from this, all these studies. So there is a space to also consider other different scales, maybe, to be included in clinical trials, not only twisters, because probably twisters is not able, even if it's an interesting scale, but it's not able to consider all the different clinical problems of patients with cervical dystonia. And also, sometimes it's not considered that the patient has to be injected maybe for not only for movement problems, but also for other behavioral problems, maybe related to anxiety or non-motor symptoms. Another thing is that usually in real life, the organization of centers where you can be injected as a patient can be different, and it depends on how the hospital is organized, how the drugs is available, or different things. And so, of course, the setting of a clinical trial is very much different from a normal life, a real life clinical setting. Another point is also that we should be probably more flexible. The conclusion about all this data is that it could be very recommended and also important to be flexible, and of course to have maybe some structure organization, but then to be flexible if a single patient has difficulties after one treatment, has to be reinjected before the time considered. The patient has to be reassured that it's possible to be reinjected when he perceived the wearing off effect. Another point is sometimes patients are not so good in perceiving the wearing off. They just have discomfort. And so also training an educational program on patients can be very important, and maybe this can be discussed in further unmet needs to propose for new studies. We can say that probably it's better to reinject patients when they reach 80% of reduced improvement compared to baseline, than compared to maximum effect, which is earlier, as we said. And another thing I would like to say that, of course, we need new scales, probably like GAS, goal attainment scale, centered on patient needs, related more to quality of life and less to severity. We need to be more, also in clinical study, more pay more attention on guides to inject patients, because maybe there can be differences also in duration. I already said about the program of maybe with an app. Now we are developing app, considering that the patient can exactly determine which is the day the effect is coming, which is the best effect, also with the numbers and the quantitative approach, and consider when the wearing off phenomenon is becoming very relevant. And so I think in the future we could help the patient with apps, because also it's a method that can help them to perceive really the quality of treatment and the duration, because the quality of the effect is related to the duration.